Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
So we should share it. Um, One of the articles is about from the Washington Post Monday's section is about uh, the relationship of uh, vaccinia virus and chickenpox and uh, getting the vaccination for shingles and how it contributes to decreasing the rate of dementia. And apparently, it's primarily by avoiding uh, the recurrence of shingles, which most of us get chickenpox when we're small, but we keep the virus in our bodies. And as you age and your immune system wanes, the virus is activated. And this activation of the virus and the inflammation associated with it is what increases the likelihood of you getting dementia as you age. And so there are many studies now that are identifying that if you've had particularly the most recent vaccination, especially if you had two doses, that the risk of dementia is decreased by 25% or more. The older you are, the greater the reduction of the likelihood of dementia. So I guess the bottom line is that shingles is a problem in itself because all of the associated pain and irritation it causes, the fact that it increases the risk of dementia is an added pain, so to speak. And so everybody should get their shingles vaccination if you can, particularly the most recent version, and saying that if you get two, it's even better than one. Any comments or questions about that particular article? Uh,
Quick, quick question, Doc. You said if you had uh, chicken pox when you were a kid, then you're immune now, or did you
no,
mean
no, I
the
said almost all of us have
cancer?
had chickenpox when we were kids, but we keep the virus. And
Hmm.
as your immune system weakens as you age, you're more likely to have the virus reactivated. And that gives you the shingles. And the shingles is when it's activated, it causes a lot of inflammation, which increases the likelihood of you getting dementia. And so if you have been vaccinated, the likelihood of you getting dementia is decreased by about 25%.
So do children get vaccinated for chicken pox now?
Yeah.
Okay, so I was just wondering how do you get chicken pox?
Oh, almost all of us, well, most of us, when we were younger, we all got it from our siblings, right? So probably 90% of adults already have the virus. So the virus is there. It's just a matter of as your immune system wanes as you age, uh, the virus then is activated. So it's already present, been there for decades for most of us. And as our immune system wanes as we age, the virus then becomes reactivated.
Okay, thank you.
Okay, the next article well, I guess the two others. One is an article about dry cleaning, showing that the toxins associated with getting your clothes cleaned are carcinogenic. And so They recommend strongly that you not have your clothes dry cleaned because of the toxins that are associated there with, uh, which is interesting to me because most of the people who can afford it get dry cleaning of their clothes. And so this is something that they are saying should be avoided because the dry cleaning process puts carcinogens, those toxins in your clothes. And that leads to the increased incidence of cancers. I had forgotten about that as a risk that we deal with all the time, but never really think much about it. Any of you not get your clothes dry cleaned? Well, think about it. Okay.
I
Yes, Lizzie.
Lucy.
I was gonna say that not that I have. Well, I was gonna say that I'm pretty sure that this information has been under the table by a lot of the dry cleaning industry. And as we're moving into, you know, similar to what we knew about carcinogens in cigarette smoking, so many of the information, or so much of the information, and its outlet is dependent upon many of these lobbying groups and its impact on us and the economy. I think as we're moving forward, it's critical that we be advocates for those gatekeepers that, in a way, kept us safe, that are no longer part of the infrastructure of our government. Um, all types of regulations and those policies and those enforcers of those regulations are no longer in place.
Yeah. So anyway, this is an alert to most of us who hadn't thought of it before because dry cleaning and the carcinogens that they use to clean the dry clean clothes. They mentioned that um, tetrachloroethylene uh, is one of the most potent carcinogens, and that's one that's commonly used. Uh, Next article that talked about is an interesting article that we talked about last week, but I'm not sure if we realize how disappointing it is that most of the people who are dying before the age of 65 are people of color. And as such, that means that they are under 65, so they're not living to take the retirement benefits or the Medicare benefits because they're dying early. And the majority of these people who are dying early are people of color. And so, uh, what do we do about it? I think what we do about it is to have programs like this uh, all over the country, uh, empowering them to uh, have healthier lifestyles, eat less, eat more plant-based diets, and exercise and meditate and do things like yoga and those other things that are decreasing inflammation and increasing lifespan. So this is another example of where information is power, and we, as a group, are not utilizing that information. And as a consequence, we're dying earlier. And when they look at the data, the people who are under 65 who are dying, who are whiter in the 30s per 100,000, and blacks are well above 40. So and this article talks about as he looks at all of these notable people, celebrities who are dying under 65, and how many of them are people of color. And so it's important for us to uh, tell our children and grandchildren and great grandchildren about the importance of adopting a healthy lifestyle. Any comments or questions about this? Something that we have been talking about for quite a while.
Yeah, my comment is that I just wonder when we're talking about black people under 65. I'm wondering if the high mortality rate is just because they won't go to the doctor.
That's part of it. They mentioned that as part of it. Yeah, well, particularly black males won't go to the doctor. The black females may go to the doctor. The black males are not going to the doctor. So yes, your pickup is accurate. That's one of the things they mentioned, that they're not going to the doctor and they're not adopting healthy lifestyles. Lucy?
Just backing
Oh,
up
go
to
ahead.
the dry cleaning thing. You know, you're professional. You got to wear suits all the time. And for entertaining, I'm wearing a lot of suits and jackets. And I sweat when I'm performing. So I take them to the dry cleaners.
Hmm.
So there's some alternatives I just looked up, like they call commercial wet cleaning. So I got to search for those places that uses water and specialized detergents instead of the dry cleaning chemicals. Another alternative is to hang your clothes in a well ventilated area to let them air out, and sprinkle them with baking soda for a few hours to absorb the odors, and then brush it off. Steam cleaning, if it's a small garment like a shirt that you normally dry clean, to just hand wash them in a mild detergent and steam dry them or air dry them as some alternatives. But I got to look at that because you wear suits all the time. I wear suits all the time. Got to do something rather than let the dry cleaners kill me.
Yeah, thank you for sharing. Thank you very much. Lucy? Lucy, did you have a
Dr.
comment?
Perez, you're muted.
And to that point, policy, so many. I know my children, I talk about pulling out an ironing board and an iron, and they look at me like I'm crazy. Everything, they just throw everything in the washing machine at the same time, and whoever, you remember spray starch? And pressing shirts and all of that. We're dinosaurs because they have moved in a totally different direction. But the other issue that is so important, the disparities and us dying early and dying at a time in our life where we provide wisdom. We worried about the generation we lost with HIV being young. And here is a time that there's wisdom in our stories. We are going into another revolution that most of us lived through before, where we're talking about voting rights and equity and inclusion and all of that. There's wisdom in our stories. And since we're not getting together next Thursday, but prayerfully we will be breaking bread together with someone. Let's share what we've learned. I've learned so much. Um, so anyway, that's it. I love you guys. I thank you so much for this opportunity to learn from you. Thank you. Thank you.
Janice?
I just want to tap on to what Dr. Perez has said. The newer generation is so different. You tell them they have an ailment of some sort. Oh, there's a pill for that. When it comes to ironing, we took my granddaughter back to school this year. Everything was stuffed in a bag. And I said, these shirts look clean. Didn't you say you have a program or something tomorrow? There's starch. She said, what did she say? You don't iron anymore, you spray it. She said, I've never ironed, Grandma. I said, are you serious? I mean, it's just trying to get used to the way they live, but I want her to come up to the way we live. But she said, no, it's a spray for that. I've never ironed. I was amazed. So you never know. And going to the doctor, you're right. A lot of people are afraid. Um, I have a sister who needs knee replacement for almost, it's getting close to 2 years now. And I'll never have a doctor cut on me again. He will. What did she tell me this week? I don't think I could take it anymore. But why wait this long? I mean, she's in pain. I'm going to try to get through Christmas. But some people are just afraid.
Yeah.
Mm-hmm.
And not to speak of adopting a healthy lifestyle, which, of course, the earlier you adopt it, the healthier you can be and the longer you can live. And
So true. She's overweight too.
yeah,
So, yeah.
well,
Yeah.
okay. Well, anyway, I wanted to share that. And then a final article that
Yeah.
is the importance of walking for at least 30 minutes a day
Mm.
increases the likelihood of you living long and also decreases the likelihood of you getting heart disease. So that's something we talked about as well. But anyway, those are three things in the Washington Post this Monday that I thought I would share with you. So we can go to our articles now, unless there's any discussion. This is an interesting article that brings up a very important point that we know that many kidney diseases are genetically caused, but information has not been shared well. And so many people are not aware of the fact that there are genetic testing that can point out uh, that there are many genetic kidney diseases, including uh, FSGS, which is focal sclerosis and glomerular cirrhosis, which may be the main reason why we have more kidney disease than anybody else. Of course, there are other, like Alport's, which is a solely genetic disease, but actually, FSGS is far more common than Alport's, and FSGS is genetically related. And there are tests that one of the problems when they tested people for genetic diseases, only about less than 5% were people of color. And so the information that they got didn't really uh, uh, didn't include a lot of people of color. And so we need to have more tests and more genetic testing of people of color so we can understand how important it is to get the genetic testing so that, for example, when you get a kidney screening and you find that you have protein in your urine, one of the important things to do then is to get genetic testing to make sure that your problem is not genetically related. Although they don't, in this article, they don't really point out uh, that many kidney diseases are genetically related, and that's something that is generally not known, as this article points out. John?
Yes, Dr. Callender, what do you do after you have a test and it comes back positive? You find that it is genetically related. What can you do? How does that change anything?
Well, if you have, uh, for example, if you're going to need uh, transplant or something like that, then they would want to find a kidney that doesn't have the same genetic association that you have. There's an MYH9 gene and APR1 gene that if you have that, you should be sure that the donor doesn't have that if possible. Uh, the other thing that you can do is to, if you have that gene, one of the things, some of the genetic kidney diseases, if you get a kidney from somebody who doesn't have the gene, then that would eliminate that problem. But other than that, uh, for example, if you had Alport syndrome, the only thing that they could do right so far, since they haven't found a way to use uh, gene editing for kidney disease, down the road, that may be something that they will be able to do. But right now, they would a kidney transplant would overcome that genetic predisposition. Other than that, there wouldn't be anything other that you could do because we have not yet perfected the gene editing technique so that we could change the gene pattern. Darryl?
Thank you.
Yeah, if the genetic testing show that somebody had likelihood of kidney disease, then one of the indicators of that would it possibly be low tolerance for sodium?
Well, so far, I haven't seen that correlation because there's so many other correlations because of the glomerulonephritis, which is more common than the salt uh, association. But one of the things that I would have to add is that I'm not sure anybody has done any testing to identify uh, the association of salt uh, sensitivity and the genes. And so until we get that done, it would be hard to be able to find that correlation. It might be,
Okay,
but we haven't really done tests that identify the salt sensitivity and the genetic association yet.
all right. But if somebody did testing and they said, genetically, I've got a chance for kidney disease, most important thing they could do is maintain the healthy lifestyle to prevent the progression of the disease, right?
That's right. And to control the controllable circumstances such as high blood pressure, salt retention, and I think if you've got diabetes, to keep your diabetes under control. And so those are the things that we normally would do to control the controllable aspects, keeping your blood pressure normalized, keeping your blood sugars normalized, would be the things that we would do to try to keep your disease from continuing to deteriorate. Any other comments or questions? Lucy?
I think it's important to note that a lot of our research moving forward in the arena that you just talked about in terms of genetic alterations. Unfortunately, philanthropy in the arena of research has been significantly impacted. So it is important that we push for the studies that may not be associated with a drug product, but in good population health.
Yeah, I would also let you know that uh, you had made some comments about the need for the GLP-1 drugs and how they interact in people of color. And I noticed that there have been some grants awarded recently for just that. So people are taking your advice.
My advice.
Uh, Dr. Callender, you know my question. I think you might have mentioned it. What's the cost of this type of genetic testing?
Very, very cheap for the most part. Yeah. The first, uh, so far, genetic testing for kidney disease is not expensive, but I don't know exactly how expensive it is. I do know that it has not been an issue. The greatest issue is the lack of interest in getting genetic testing so far right now. Now, if it got to the point where everybody was asking for it, that would make it even cheaper. But as far as I know, the price of genetic testing for kidney disease patients is not prohibitive. Darryl?
AI overview says cost of genetic testing for kidney disease varies widely, ranging from under $100 to over $2,000, depending on the complexity of the tests. Comprehensive gene panels can cost less than $500 out of pocket, while single gene tests can range from $100 to $2,000. Many health insurance plans cover the cost when the test is recommended by a physician, and some companies offer sponsored no-cost testing programs for eligible individuals.
Yeah, and most of the insurance will cover it if your doctor orders it. That's why it is relatively inexpensive if your doctor orders the test. Okay, let's go to the next article unless there's other comments or questions. This is an interesting article suggesting that if you take three or more drugs at the same time, then this improves heart failure outcomes and improves the likelihood that people will take their medication. It's clear to me that many of the deaths that people have who have heart failure is related to the fact that they don't take their medications. Uh, have some have a number of family members who have died because they don't take their medications, and the polypill concept of putting drugs in one pill suggests that this may be the way to go to try to help that issue. John Buchanan?
Yes, Dr. Callender. Uh, two questions. Could it be multiple pills or not just a single pill with multiple treatments in that one pill? And the other question is, what is injection fraction?
Ejection fraction. Okay, the ejection fraction is normally for the heart, you'd like to have an ejection fraction, which means the amount of blood that your heart is pumping out is greater than 50%. That's what you'd like to have. And if your ejection fraction is down to 10 and 20%, that is not consistent with you surviving very long. The other part of the question was
Multiple pills or
yeah,
combined?
we're talking about having three pills in one. And uh, and your question about that is what, John?
Is it three different pills or they're all combined into one pill?
Three pills combined into one pill.
Okay.
Yeah. Okay, Darryl?
Are those poly pills expensive?
Uh, for the most part, insurance will cover it if you have health insurance. If you don't have health insurance, then it'd be a different issue. But uh, most of the people who have insurance, and so it becomes inexpensive. But if you had to pay for it out of pocket without health insurance, it might be expensive.
Okay, and reason why I ask that is when you said people don't take their medications. I know that in a lot of cases, you can't afford to take your medication. It's a choice between paying for your medication, even when you have insurance, or eating.
You're absolutely right. This is an issue that we um, becomes even more critical as we talk about the shutdown and the health insurance issue that is now becoming critical because as Obamacare becomes less applicable, then more and more people will be underinsured and they'll have to pay for their medications, which means they won't, as you mentioned, they won't take their medications. As a consequence, if you have heart trouble and you don't take your medications, you're usually going to die.
Yeah. As an alternative to expensive medication, I don't know that a lot of people consider uh, importing their medications from out of country, like from Canada, any place in the world. You can just do a Google search. Where can I get this medication cheaper? And it's not going to be at your pharmacy. They're going to have to ship it to you, but the cost can be dramatically lower than what you would pay at your pharmacy from the United States pharmaceutical company.
That's if you don't have insurance, right? Because the reduction with insurance is uh, tremendous, probably uh, 80% reduction
Well, I
with
take
insurance.
Eliquis, and
Yeah.
the uh, my insurance with insurance, the cost of my Eliquis is something like over $200 a month. Uh, Canadian pharmacy, I can get a 3 month supply for 160.
A big difference. Big difference. Thanks for sharing. Lucy?
Um, I think it's also important at this point to say that you are digitally sophisticated. And some of my colleagues and friends are not. And some of the biggest scams are occurring because of the logarithms associated with what we do online. So I think that we need to help each other in this manner for those who may be getting pharmaceuticals outside of the country, but it may not be for everyone. And seasoned saints tend to be taken more advantage of. And I know I just recently spent some time with my daughter, and I was shocked at how different the commercials on TV were when I first got there and then when I left. So, because of what I watched, because of what I did online, the commercials they had on TV were selective. So I just say that to put some caution in to what we might do online if we do not have um, expertise in that area.
John, you had a comment?
I had a question. It seems like um, very dangerous or open for a lot of error. Each individual person may have a different requirement for what goes into that poly pill. It just seems there's no one poly pill, you know, like whether you take a Tenolol or another uh, uh, chemical for blood pressure. If you combine them, I mean, you could have 5 milligrams of one and 10 or 25 milligrams of another. Uh, it just seems like it would be hard to do it on an individual basis. What do you think about that?
Well, it's something that the cardiac specialist is got to work on with the patient because um, it's life-saving. And I think your point is well taken that the poly pill may be one thing for one person and something for another, but the doctor working with the patient, getting the patient to the point where they will at least take the medication is so important that it's life and death. And so yes, it is something working towards a situation where you can use the right combination of drugs that will work for one person, so they will only have to take one pill. And if that works, then that would increase the likelihood of their survival and the likelihood of them being compliant. Darryl?
Yeah, I just read something that says poly pills are formulated by combining multiple medications into a single pill, and so that allows the doctor to customize it to that individual patient rather than I think John Buchanan was thinking like one pill fits all. So if you have three different drugs, you could say 200 milligrams of this drug, or along with 500 of this, 700 of that, and so you're getting something that's custom tailored to the patient.
Yeah, well, but the truth of the matter is that one size does not necessarily fit all. And so while that combination may work with some patients, for some patients, you may need a different combination. And that's where the problem comes. Because uh, the poly pill is a pill that where you've got the three medications in one pill with a certain uh, combination of milligrams. So if you really wanted to individualize it, it's not always that easy.
Well, that's what I was thinking. You know,
Right.
uh, how can a pharmaceutical company make any money when you have one person with this specific combination of medicines?
Well, one size doesn't fit all, so it's something that the cardiologist got to work out with the patient so that you try to accomplish with one pill what you would want to do with three different pills, uh, but get to the point where they are taking that one pill all the time and not missing any medications. Because
So I'm sorry, who does the mixing? Is it the pharmacist?
yeah, yes, in other words, the pill is made by the pharmaceutical company. So you find a combination that you think would work with this particular patient, and you give them that combination. Uh, Darryl, you want to make a comment?
Yeah, well, I know that pharmacists can compound drugs so
No.
that if they get, if the prescription calls for 5 milligrams of that, okay. Um, if they're making a batch of 30 pills, they have to take all the measurements times 30 and then separate them into, mix them, separate them into individual capsules. Um, But I know they can compound drugs, so it would seem to me like the pharmacist could uh, make a poly pill right there in the pharmacy.
They generally don't, though. Uh,
Okay.
Generally, the polypills come already uh, put together,
All
uh,
right.
and the doctor then has to identify the strengths of the polypill and decide which is best suited for the patient. And for the most part, the polypills come with certain milligrams. And the compounding that you're talking about for the pharmacy is not something that is often done. It's usually a pill that has three drugs at a certain potency. And so they try that one and see if it works. But it's something that is being worked on. Uh, and I think with time, they'll be able to get to the point where you can do what Darryl is hoping could be done with compounding by the pharmaceuticals, but I don't know that it's being done yet. Most of the polypills have a prescribed dose already in it. And that's why sometimes the patients are not compliant because they don't have they have to take three different pills when the best way to do it would be to take one pill, which has the three different components. And so that's something that is important to have worked out too. But that is not always the case yet. So
Well, if we can hang on long enough, it says in the future, customized poly pills, um, pharmacies may use 3D printing technology to create customized poly pills on site. So if we can hang on long enough, we'll get the benefit of the future.
that's right. Yeah, that would really be something. Yeah. Okay. Any other comments? Because this is, as Darryl has said, that's where the future lies. But all that being said, uh, if you have insurance, it makes it a lot easier. On the other hand, if you have no insurance, then that expense is a problematic, and Darrow's solution might be one of the best ways to get medication as you can afford. Okay, let's go to the next article unless there are more questions or comments. This this is interesting in that they're considering exercise as a polypill. And I think that makes sense. It's just that I don't know if doctors actually prescribe it as such, but it's something that is fair game. Uh, the question is, how many doctors actually do that now? And I don't know. And there are a lot of doctors that do it now, but it is important to do, to put it all together, the healthy lifestyle along with the uh, diet and exercise and everything else that goes along with it, along with the patient monitoring their blood pressure at home. I think this is the way to go. Uh, and they talk about the colonoscopy and the way in which that has helped decrease cancer by identifying polyps that could turn to cancer and removing them early before they transform. And then they also talk about the incarceration of people who dying and other aspects. They talk about the merit of putting terminal patients in jail, and that brings the ethical issues that are rarely discussed, because rarely are palliative medicine people involved in the incarceration process. And of course, who are the people who are incarcerated? People who look like us. So this is an issue that is not surfaced, but it's one issue that is very important to us. Any comments? We tend not to.
Thank you for including it because it's so very important.
Yeah, well, I think we tend not to talk about incarcerated people, although most of them that are incarcerated are people who look like us. And that's something that we need to address as well. That's an industry unto itself. Yeah. Okay, we'll go to the next one unless there's questions about it. Yeah. This is kind of a ridiculous article about paying people to take hypertensive meds, which has been studied. But the concern was how long you have to pay them, and when you stop paying them, will they still take the medicine? And so to me, it's preposterous. But anyway, it's food for thought, and they actually did this, and as long as they were paying them, they took the medicine, and when they stopped taking the medicine. It's kind of crazy, but it's like welfare, so to speak. Yeah. Some argue is welfare good for you or not. Anyway, so somebody did actually try this, and it worked as long as they were paying. So, what are your thoughts about that? Does it make sense to you?
Sit up. You're gonna have to sit up. I can get this.
Any comment?
No, I gotta go, and I want to make sure you eat. I gotta
Lucy?
go.
You know, so much of it has to do with how you value yourself. And if you see value in who you are. And so much of what has happened in our healthcare system, many patients never get to the opportunity of having a relationship with their physician. And so much of what we find in just looking at the qualitative components of the research, there's also human interaction that's going on. And so like when we're talking and with our family this Thanksgiving, we're pouring into them how valuable they are to us and why taking care of their health is important. Because that is where the disconnect. So our families are so distracted by so many things in our environment that's going against them, that keeping themselves healthy is a very low priority. And there's something wrong with that.
Well, one of the things is that you talk about distractions, and one of the distractions is the football games, or the basketball games, or whatever. And so that you have more talk about that than you do about health, if you have any talk about health at all. And so, for a change, that would be an opportunity to make a change for the better. But competing with the football games and the basketball games is not easy. Any comment as we face next Thursday?
I had a quick comment. If you look at a lot of these athletic teams, there's been a lot of injuries that definitely affect the game and the enjoyment of the game when your team starts losing because of a ton of injuries. So, I mean, that's health related, isn't it?
Yep. Well, these days the injury total is overwhelming, and so and that's going to affect your team as well. Darryl?
Yeah, holiday meals, Thanksgiving and Christmas, those are the most unhealthy meals of the year. High calorie, high fat, high everything that's bad for you. And it's hard to have a conversation about let's be healthy when you got the unhealthiest thing all year right on the table.
So true, so true, so true. Yeah, well, yes, yes, you've said it well. It is also the time when you have more depression and suicide. And so it's unhealthy for so many reasons. You know, when you talk about holiday season, you talk about people who are no longer with the family, which is a source of depression, and so the suicide rate goes up. Uh, so so it's an interesting time, as Dal has put it. It's the most unhealthy time of the year, but yet uh, you got the distractions. So talking about staying healthy becomes an interesting issue to surface at that time. Any other comments? How are you going to handle it with your family?
This is Sylvia. Good morning, everybody. Um, Thanksgiving dinner, how I try to handle it is I know there's a lot of food. Our culture's got to have five meats and I don't know how many sides, but I always try just to take a spoonful, a little bit of everything. But it is what it is. We just get together and we just eat. That's just part of our culture.
Janice?
I agree, but that's life, especially Black lives. We get together as family. I'm blessed once again, good or bad. I'm hosting, and I've always have hosted. Big house, small house, they come. We eat, but we start off with our blessings. We still have a lot to be thankful for. Um, some are in great health, some not so great health. But it's a time to bring everyone together, and you're going to eat anyway. I think a lot of people, especially in my family, well, I haven't had this or that in past 2 weeks, but I'm gonna eat today. But that's what Thanksgiving is about. You're thankful for the food, but you're thankful for just being here and being with family. So it means a lot to my family.
I think that's an opportunity. As
Yeah.
you mentioned, most things start with blessings. So that's
Yeah.
the time you can bring in the health issues before they start uh, demonstrating what not to do. John, I guess you have next, and then Darryl.
Yeah, I remember very clearly one Thanksgiving I might have shared this last year where the food was so good. I mean, it was delicious. My cousin made some stuffing with oysters in it. And I mean, they had greens and mashed potatoes and turkey and ham. I mean, it was so much. And I tried, like Janet said, just to take a little bit of each one. But at the end of the meal, it was so good. Check this out. I had a clean plate because my mother said, you do not get up from that plate if you have any food left on that plate. The clean plate club. So it was so good. Check this out. I went back and got some more because it was so good. Afterwards, I remember sitting in the living room. I was miserable. My stomach hurt. I was falling asleep because the turkey makes you go to sleep. And I said, I will never, ever, ever do that. I felt so bad. I will never do that again. So I've learned from that. Just take a little bit and be satisfied, be happy, be thankful. Thanks.
Okay, Darryl.
For the last 55 years, I've been going to Carol and John's for Christmas. And they have the typical spread. They have everything. There's a bunch of desserts, there's a bunch of meats, there's mac and cheese. And let's see, I haven't always been good, but for the last over 20 years, I've never indulged. I've never gotten off a strict vegan diet. So when all the food is there, I don't take a spoonful of everything. I only take, I make my own food, or Carol prepares some food that matches my diet. No butter in there, vegan, no milk, no cream, no sugar. And so I don't ever get off track. So I guess there's different ranges of what you can do. There's the in moderation, take a little bit of everything, or don't get off track. Well, I'm at the opposite end, the extreme. I never get off track.
Okay, that's what makes you Darryl. Okay, any other comment as we prepare for next Thursday? Um, this article is about the new blood pressure guidelines, which we've talked about before. And the new target is 130 over 80. Um, and they talk about classifying it as stage one hypertension, stage two, and so forth and so on. But it seems to me that we change almost every year. So, but I think the bottom line is that you should take your blood pressure at home, and uh, you should try to see that it goes no higher than 130 over 80, and that's that's the new guideline this year. So we'll see. Any other comment? But I think the biggest thing to do is to take your blood pressure at home, monitor it, uh, and ensure that it stays around 130 over 80 or lower. John Buchanan.
Yeah, I did my 114th blood donation yesterday at the NIH Department of Transfusion Medicine. And of course, they take your blood pressure. Mine was 129 over 56. I was so proud. Yes.
Wow, good. Congratulations. Wonderful. 114. That's wonderful. Blood transfusions is such a wonderful, it's interesting that Charles Drew, who is the former chairman of our Department of Surgery, is internationally known because of the fact that he made blood transfusions and plasma transfusion around the world popular and saved millions of lives and as such. And so John is a role model for all of us in doing something that saves lives every time he does that. So congratulations, keep up the great work. What a role model you have become. Any other comments or questions about the blood pressure issue? Has everybody got a sphygmomanometer to take their blood pressures at home? Uh, if not, it's pretty mandatory that you do have one. And doing it once or twice a day is not hard to do. Any comment? If not, we talked about getting the urine protein for everyone. Uh, and if you have protein in your urine, then this is a sign that you're developing kidney disease. And so it becomes even more important to monitor your blood pressure. This is an article that talks from UK that talks about how the high blood pressure at the age of 40 in men means that your heart is strained, whereas in women, it isn't necessarily the same thing. Now, this is a UK study, and it doesn't go into detail how many people of color are involved, but it does talk about men and women differently. And the impact upon the heart is not the same in men and women. In men, the strain on the heart is evident. In women, it is not, which suggests that with men, it's more likely to result in heart failure if the uh, hypertension is not checked and not treated properly. Whereas in women, there's less of a likelihood to have that strain. What's the real bottom line is to keep your blood pressure under control, whether you're a man or woman, but recognizing that with men, it's more likely to affect your heart than it is with women. Okay, any comment or questions? If not, we go to the next article. We talked about the smart watch and the app and the fact that arrhythmias may be detected, uh, which the structure of the heart is involved. And of course, the leading cause of death from heart disease is arrhythmia. And so one of the advantages that people have smartwatches is that uh, if you have an arrhythmia, it will manifest itself in the smartwatch app. And if you pay attention, you may wind up going to the emergency room and identifying early uh, something that could lead to your death that wasn't detected. And this is something that may uh, that would be a better present for uh, people of color to uh, get them to identify an early structural heart problem before it becomes lethal. And so it may be a better present to think of giving somebody than some other presents. Any comments or questions? As we've talked about this before, because uh, people who are wealthy more likely to have smartwatches that will lead them to the emergency room for arrhythmias that are treatable, whereas people of color who aren't uh, economically ready do not have that, and as a consequence, they wind up going to the hospital because they arrested or something like that. And so it's something that I think it is worthy of looking carefully at to see how people of color can get more involved with this smartwatch app. Darryl.
I've got an Apple Watch with the ECG app, and it was very accurate in detecting AFib episodes. And I had mine fixed with a catheter ablation. So that proves up the whole point of this story that smartwatches can help, and you can get it fixed.
Yeah, so how do we make it available to our people of color? That's the other question. Because I think there's a role to play in terms of making it more available to us. We see we're dying earlier than 65 anyway. So it seems like it would be more applicable to us than to people who are not of color. But any thoughts or comments? Lucy?
It sounds like a policy change to me, just like was done with CGMs, the constant glucose monitoring. It sounds like durable medical equipment. We need to be in a posture in which we impact on what is paid for by our insurance. And, I was thinking about how important it is for our young people to appreciate this impact on them in terms of civics. And this is a policy change, and educating our legislators about how important it is a mechanism by which we could make it available.
It makes sense. The question is, how do you go about doing something like that? Because it, in many ways, would be revolutionary.
I believe it begins around our Thanksgiving dinners that we will be having on Thursday. We don't know who knows who. And if we are given an opportunity to plant a seed, we will be amazed by how and what impact that seed might have. And I can't tell you how much I learned. I'm just digesting it now more than 70. But around the Thanksgiving and Christmas tables, I am so grateful for them now, because I don't think I would have been here if it wasn't for those discussions.
Any other comments? Well, thank you for sharing, Lucy. Okay, let's go to the next article then. Yeah. Oh, when you read these stories, it's painful. Just like this 47-year-old nurse told her crushing chest pain was indigestion. One of the things that we teach our students is that indigestion is a heart attack until proven otherwise. This nurse had uh, crushing chest pain, sent to the hospital. They told her she had indigestion, and she died 3 days later with a dissecting aortic aneurysm. It's hard to imagine that she would go to the hospital in the UK and be sent home with with a diagnosis of indigestion. But it happened there and it happens here. And it's scary. Darryl?
Is there any possibility of a false negative, like that they did some EKG, stress tests, whatever, but it turned out to be a false positive and they sent her home?
Anything's possible. But when you have chest pain like that, uh, sending somebody home with chest pain like that is not defensible. Uh, Even if you have a normal EKG or whatever, there's so many other tests that you can use to identify the fact uh, that this is more than indigestion. We have enzymes that you get. Uh, you have an EKG. You have uh, other ways of testing to rule out an aortic aneurysm. Usually, a CAT scan is or an MRI would pick it up, but the fact that you have that kind of chest pain that won't stop and is not something that you would send somebody home with. Lucy?
Disparities. This is bias. It's bias, and it's what we have been talking about, and it is critical. It is critical that we be aware of this and that we talk about this. And now, especially those of us who might live in rural areas where decisions have to be made, critical decisions have to be made, there is bias. And there are people who do not value our lives.
Are you talking about women or
I'm
people of
talking
color?
about women, I'm talking about men, I'm talking about Black people.
Well, this lady's not Black.
But I am saying, even in that case, there is bias.
Absolutely.
I mean, we talk about gender, hysterical, mad Black woman, and then we don't put those things in place that makes us aware of our bias.
Yeah.
We lie and we make excuses. And I heard that an excuse was a lie pretending to be a reason. So it's important for us to call this what it is, whatever that bias is, and call that bias out, because people are dying because of it.
Yes. And I think one of the things that this points out is that for women, heart disease may manifest itself different than it does in men as well. But this particular dissecting aneurysm is not something that you should miss, regardless of gender or complexion. But anyway, it's important to realize that yes, it is bias, and we have to call it out for that.
Something we talked about before is that they receive less effective care for heart attacks compared to men. And sometimes that's because of a difference in symptoms. Um, like women are more likely to experience additional symptoms like shortness of breath, nausea, and fatigue than men are. But, bottom line is that women often get less effective care for heart attacks. So this may be bias, sexual bias in operation in this case.
Mhm. Yeah, it's good that they pointed it out because this is a nurse who was an advocate for the healthcare system, and the healthcare system failed her. Yeah.
Did it fail Charles Drew?
Yeah. Any other comment or? Well, keep that in mind. Indigestion is a heart attack until proven otherwise. And dissecting aneurysm is a situation in which the uh, circulation goes in between the vessels. And when you have an aneurysm like that, it can rupture, and that's fatal. Yeah. It can be treated effectively by surgery, but if you don't intervene rapidly by surgery, it's lethal. Janice?
So often during our sessions, we focus, of course, on seniors. And with seniors, of course, our bodies aren't quite what they used to be. And I have some very dear friends who now live in Florida, and they've been here for the past month. And it's a couple, male and female. And she's been telling us, oh, he's so lazy. He is so slow. I asked him to do something, it takes forever. I try to get him to exercise. He says he's tired. So they went back home and she said, I'm going to take him to the hospital. He's still complaining. Well, it was a cardiac issue
Yeah.
and he had blockages. And the next day he had 3 stents put in. And almost immediately he said he felt so much better. But again, at our age, sometimes the simplest things are worth checking into. And so we have to be mindful of our health and our loved ones' health. Just check it out first.
Thank you for sharing. So important.
Yeah.
What you shared was so important. Yeah.
Yes.
So interesting. The last thing she thought of was getting it checked out by the doctor.
Yeah. Yeah.
Yeah. Yeah. Well, okay, if there are not any other comments, we'll go to the next article. This is an interesting article that says coffee a day to keep the AFib away, suggesting that caffeine uh, will treat atrial fibrillation, which, as Darryl talked about earlier, is a situation that requires intervention. And the fact that coffee uh, is thought to be helpful is interesting because it was really previously thought that uh, caffeine was the cause of the atrial fibrillation. Um, Atrial fibrillation is problematic because it leads to blood clots, strokes, and uh, things like that. And the treatment, as Darryl had mentioned, is cardiac conversion. That's one of the treatments. The other treatment is, of course, anticoagulation, because the incidence of blood clots in people uh, who are anticoagulated are less likely to have stroke with atrial fibrillation. Of course, conversion is thought to be the state-of-the-art treatment, and if that isn't effective, then anticoagulation is. I don't think there's been a study that would say that if you took coffee, it would uh, cause you to have electrical conversion. It's just that um, there are a lot of different studies that have differing results, and so it's hard to. Most people would say to avoid caffeine, but in this study, they're talking about the fact that caffeine, uh, with or without caffeine, you have atrial fibrillation, and cardiac conversion is the treatment of choice. Any comments about this? Because their study doesn't confirm or deny that caffeine is related in any way to atrial fibrillation. Any comment about this? This is a common disease, though, as we age. We have arrhythmias, and atrial fibrillation is one of the many arrhythmias that you can have. But it's one that is associated with increased likelihood of stroke. So it's important to treat it. Whether you treat it with electrical conversion or you have anticoagulation. Yeah, your doctor talked to you about caffeine as the cause of atrial fibrillation?
No, he didn't. No conversations about that. Um,
Mhm.
in my case, it was more likely as a result. A lot of marathon runners is particularly running too many of them get AFib.
Mhm.
You know, endurance athletes like Kareem Abdul-Jabbar, he has AFib. Spent too many years, too many minutes on the court.
Mhm. Well, he spent his life spent his life on the basketball court. Yeah. Mm. Okay, if there's no comments, we'll go to the next article. Doctors are patients too. And we as physicians are sick as any other group. And we were diagnosed with heart attacks, cancers, and other things or becoming a patient. This is difficult for us as for anybody else. One of the problems is that physicians are often later to admit their problems than other people, and so often it has to be the significant other who forces the a physician, male or female, to seek help. Whether it's chest pain, abdominal pain, or whatever, because we used to taking care of people, but somebody needs to take care of us. And there are many physicians who've actually died treating themselves, uh, which is problematic as well. And one of my colleagues who treated herself unsuccessfully for pneumonia. And she died because she didn't get help. And that can be said for any condition, whether it's hypertension or cancer, you name it. So the bottom line is that people are people, whether you're a physician or not a physician. Sickness occurs to all. And often it's our significant others who can help us recognize our humanity and the need for being taken care of. I guess this is the last article. So any comments about this? I think all of you have had physicians who are no longer with you because they became sick and died as well. So to say physician heal thyself is not an appropriate comment. Now,
Would you recommend that spouses go with each other for all doctor visits?
yeah, I would strongly recommend it. Yeah. I have particularly been impressed with the inability of the male part of the package to tell the truth if they're left to themselves. So, yeah, I think it's absolutely critical that the spouse go so the doctor can get the real truth.
That is priceless. We have this on tape because we need to disseminate that to all of our brothers. That was priceless. Thank you, Dr. Callender.
You're not welcome.
Absolutely. Absolutely. Dr. Callender knows I always went to my husband's appointments and I would let him talk. And after Callender listened to him, he would turn to me. Now, what's the real truth? And I would tell him, and my husband will never argue. I would tell him the whole truth and nothing but the truth. So, yeah, I think it's important.
Yeah.
But okay, you still got to come back home with that spouse. So what I
Not a
recommend
problem.
is while you're doing your truth telling beforehand, go on to Chat GPT and get a script for what to say when it comes your turn to talk. And Chat GPT will give you a very nice, non-offensive way of saying what you got to say, so that you can leave that office visit and not make your next stop the attorney's office.
No, no, no. That'll never happen. Dr. Callender knew I told the truth, the whole truth, and nothing but the truth. Yeah.
Well, that's an interesting way to close this program. As we will miss each other, and may everybody have a great Thanksgiving Day with opportunity to share some health information at the Thanksgiving table. So thank you very much for being here today, and good to have all of you with us. And see you in December.
Happy Thanksgiving.
Happy Thanksgiving, guys. All right.
Yeah.